everyone, I am Shikaina Aquino Maranga from BSN 111A, and today I am going to be assessing the eyes, which is an important organ for our sense of sight. So prior to the conduct of the assessment, I am going to review my client's previous medical record if available, and this is done to identify instances of harm to patients, her medical histories, and current treatment procedures. Second would be to determine the scope of the assessment and prepare the necessary equipment to conserve time and energy. And for this procedure, all I'm going to need is a Snellen's chart and of course, my pen light. Third, I'm going to need to perform hand hygiene to protect my patient and myself from infection and cross-contamination. Good morning, ma'am. I'm Shikaina Maranga, your student nurse for today. And may I see your hand, ma'am? Please state your complete name.
I'm Sherry.
And your birthday, please.
November 16th.
Okay, thank you very much. And how would you like me to call you, ma'am?
I am fine being called Sherry.
Okay, so Sherry, today I'll be doing an eye assessment. So I'm going to check how clear and how good your eyesight is. And of course, check if there are certain spots or angles at which you have trouble seeing, okay? So during the conduct of the assessment, I might need to ask you to stand up, to sit down, to read something, or shine light in your eyes, okay? And all the results will be documented, but it will be kept confidential. Will that be alright?
Yeah, it's fine.
Okay, do you have any questions or clarifications perhaps?
None.
Okay, so would you mind if I close the door so that no one from outside will be able to disturb you while we're doing the assessment?
You can close the door.
Okay. And are you comfortable? Is the room temperature alright?
Yeah, I'm comfortable.
Okay, so let's begin. So if I may just ask, do you use any contact lenses or graded glasses?
No, I don't use anything.
Okay. So now I'm gonna have to ask you to stand up. Okay. So what I need you to do is to use this cardboard to cover your right eye first, like this. Okay, and then try to read the letters that are written in the Snellen's chart, just up until the letter that you can still see. Okay. And then after doing that with your right eye covered, you have to do it again with your left eye covered. And again, and for the third part of the procedure, I need you to read the letters in the Snellen's chart with both eyes uncovered. Okay? Okay, here, place it in your right eye. Yes, and you can start reading the letters.
E, F, P, T, O, Z, L, P, E, D, P, E, C, F, D, E, D, F, C, Z, P, F, E, L, C, P, Z, D.
Okay, and do it again with the other eye.
E, F, P, T, O, Z, L, P, E, D, P, E, C, F, D, F, D, F, C, E, P, F, E, C, L, F, E, D.
Okay, so I'm going to take that cover and please read the Snellen's chart again.
It's E, F, P, T, O, Z, L, P, E, D, P, E, C, F, D, E, D, F, C, Z, P, F, E, L, O, P, Z, D, D, E, F, P, O, P, E, O.
Okay, so that's good. You can sit back now. So, ma'am, I need you to tell me how many fingers I am raising. Okay? So, what about this?
1,
Okay.
2, 4.
Okay, so another, I need you to tell me what direction I am pointing my finger at. Okay?
Okay.
Can you see it?
Yeah.
Where is it? Where am I pointing?
On my right side.
Okay, and now?
Up. Down. You're pointing at me.
Okay. I need you to tell me if you could see the light. Okay? Can you see it?
Yeah.
Can you see it?
Yeah.
And where is the light coming from?
On my left side.
Okay. And here?
Yeah.
And where is it?
On my right side.
Okay, ma'am. So now what I need you to do is just to look straight into my eyes, okay? And tell me, say the word okay if you first spot my fingers in your entering your visual field, okay? Like this, and then tell me the word okay if you see it.
Okay. 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 Okay.
Okay, good. So, ma'am, you have trouble seeing with your right eye. So let's do the wiggling again, the wiggle fingers. Tell me, okay, tell me, or say the word okay when you first spot my fingers entering your visual field.
Okay. Okay. Okay.
Okay, so let's do it with the other eye.
Okay. Okay. Okay.
Okay. Okay, proceeding now, I'll be checking your eyes. So for starters, I see that your eyes are aligned and symmetrical. Your eyebrows are evenly distributed and slightly arched. So can you raise your eyebrows for me like this? And down like this. Okay, and then your eyelashes, they are both evenly distributed, and they are curled slightly upward. Okay, so can you close your eyes? Okay, lids closed symmetrically, and no discolorations, no lesions. You can open your eyes now. So I'm going to palpate for your nasolacrimal ducts and lacrimal glands. Okay. Okay. No edema, no swelling, no tearing of the lacrimal ducts. Good. Okay. Need you to look up. Okay. And alright. Now I'm going to be inspecting for your iris and pupils. So just look straight into my eyes. Okay. And I'm going to use my pen light to check for your cornea and lenses for any opacities. Okay. Okay. Okay, there are no opacities. So now I need to close the light. Okay. Okay. So I'm gonna need to shine again my pen light in your eyes to check for your direct and consensual reaction of your pupil. Okay. Okay, very good. So what I did is I shone light in your right eye, and then it constricted, and that's the direct reaction. And for the consensual, it means that when I shone light in your right eye, the left eye also constricted, which is pretty normal. Proceeding now to the assessment of your pupil's reaction to accommodation. So what I need you to do is to look or focus your eyes at the tip of my pen light, and then look at the wall at my back. Okay? So look at the tip of my pen, and then at my back, pen, and then at my back. Okay. Good. So now I'll be performing the Hirschberg test. Okay, so basically I'm just gonna shine my pen light in your eyes, and then look for the reflection of it in your corneas. Okay, so just look straight. Okay, look straight. Okay, So now I'll be performing the cardinal fields of gaze test. Okay, so I need you to follow the tip of my pen light. Okay, with your eyes only. Do not move your neck with it. Okay, just the eyes. Okay. Okay, so now I'll be testing for your convergence. Simply just follow the pen, okay? Okay. Now, ma'am, I'll be summing up everything that we've covered. So, for your visual acuity, when you were reading the Snellen's chart, the result was your right eye vision is at 20/25. Okay, and then your left eye is at 20/30, and both of your eyes is at 20/20. Okay, for visual fields, the one which I did, and I was wiggling my fingers, and then you said okay if you spot my fingers in your visual field. So your upward field is at 50 degrees, downward field at 70 degrees, and then your nasal field at 50 degrees, which is normal. Okay. So for the inspection of the eyes are aligned and symmetrical. The eyebrows are evenly distributed and arched. Eyelashes are evenly curled upward. For the eyelids, skin is intact. Lids close symmetrically. No discharges, no discolorations, and you have normal blinking, which is at 15 to 20 blinks per minute. Okay, and so as I was palpating for your lacrimal gland and nasolacrimal ducts, there was no edema, no tenderness, no swelling or tearing. Okay, sclera is white, which is normal, and your bulbar conjunctiva too is good. Iris and pupil are both normal, no opacities, and the pupil is at 3 millimeters, which is normal too. So your pupil's reaction to accommodation is normal too. The one that we did when we were looking at the tip of my pen, if you look at the wall, that's the accommodation. And cardinal fields gaze test, both eyes are coordinated, no jerky movements. So everything is pretty normal. So that's everything so far. There's no problem with your eyes, and I just advise you to minimize your exposure to your cell phone screen. Continue to consume vitamin A rich food, which is a vitamin good for your eyes. Okay, and then have rest after hours of spending time with your cell phone. Okay?
Okay.
Do you have any questions or clarifications?
Nothing.
Okay, so that's it for our eye assessment. Thank you very much for your cooperation.